on the East Coast. My name is Drew Clark. I'm the editor and publisher of BroadbandBreakfast.com, and we're here for today, March 30th edition of Broadband Breakfast Live Online. We're going to be talking today with a group of millennials, all of whom I know. I'm really proud to have them on. This will be a little bit of a unique show, a little different from some of our other webcasts, but we are going to be talking about the impact that the coronavirus has had on these individuals' lives and how broadband is helping them adapt. And we'll talk as well about that, about the schooling or work or other activities that they're involved in. So I just want to thank you all for watching and knowing that you can come back here. We've been doing this as almost an experiment for about 2 weeks, this Broadband Breakfast Live Online, and we'll continue till the end of the month, till tomorrow. And we're very excited. Each of these episodes are available online, and you can, of course, also subscribe at broadbandbreakfast.com to our semi-weekly newsletter. So with that, I'm going to go ahead and open it up to our panel. We have Stuart Silver, who's my nephew. We have two good friends, family friends, Hannah Coyle and Ashlyn Coyle. And then my son, my oldest son, Elder Elijah Clark. This is one of those unique opportunities where I get to call my son Elder Clark because that's his title while he's serving as a missionary. But we're going to go ahead and start with you, Stuart. Tell a little bit about what you've been doing and where you go to school and what's happened in your life over the last 3 weeks, 4 weeks, okay?
Great, yeah. So I'm a senior in my last year at Swarthmore College just outside of Philadelphia, Pennsylvania. I study biology and minor in Spanish. So getting ready to graduate under some now unique circumstances, as I'm sure we all recognize, and a lot of people around the country and around the world are going through. So I have bounced around a little bit with school-wise, but I've been at Swarthmore since I was a junior, and really, I think one of the hallmarks of Swarthmore and small liberal arts colleges generally is the ability to interact closely on campus with peers and with faculty, and to be able to have a really holistic and welcoming learning environment, which has obviously changed in some substantial ways as Swarthmore, among, I imagine, most colleges and universities throughout the United States, have closed their physical campus doors to send students home for the duration of the semester, to transition to some type of online learning. And so that's been an adjustment, new learning opportunity for all of us, including myself. So I've been in Ohio with my family and my parents and 5 younger sisters. We've all flocked home with this global pandemic to have a home base, which has been lovely. I feel very fortunate to have that opportunity to be in a stable environment during this time. I know of people certainly and have some friends for whom that's not as easy of a transition, who have other responsibilities work-wise or school-wise. And so that's been really great.
Let me jump in and ask you a question, Stuart, about what the schooling has been like. We actually began our program 2 weeks ago with one on higher education and this was just the very week that Columbia, University of Washington, Harvard closed their doors. I assume Swarthmore was in that same time period. Tell us what. Has the campus, has students adapted easily, seamlessly to education at home? What is it? Are all your professors prepared for this, or is it pretty ad hoc? Talk a little bit about that, if you don't mind.
Sure. So this was all going down during our spring break, around March 10th, March 12th, that week, and so I was actually in Spain on a class trip for my honors seminar course while this was all happening. So there was a little bit of drama there. We were some of the first to know the college's decisions because it could affect us coming home and what would happen for the rest of the semester. And so initially, Swarthmore, even though other colleges were closing initially right for the whole semester, Swarthmore wanted to take a middle route. So they decided to delay for 3 weeks. They gave us an additional week of spring break and announced 2 weeks of online classes before letting students come back to campus. Within 5 or 6 days of that announcement, it was clear that was not going to be a reasonable timeline to come back to campus. And so once most students either returned quickly to campus to grab a few things, or most that were home on spring break just stayed home, and they closed access to campus, and said, students, if you need some things, we'll try and ship them to you. But stay home. We don't want you on campus. We're going to try and slow down the spread of the virus. And so we had a second week of hiatus from classes, sort of a second week of spring break, and then classes have started, I guess, last week and now continuing to this week. As a last semester senior, I haven't had a lot of courses actually to attend. I have a seminar for my Spanish course that meets just once a week, that we video conference in and discuss the readings and some of the projects that we're working on, and then have recorded lectures for my intro psych course that I'm watching and learning, and then working on a thesis independently. So for myself, there's not a huge amount of purely online content to adjust to, but I realize that that's something else that a lot of other teachers are frantically trying to put content online and figure out ways to Zoom conference with all their students.
Right. Now, what was it like being in Spain? Did that affect, did this decision of Swarthmore to go online affect your trip there? And what was sort of the cognizance of the virus at that time? This was early March, or at least mid-March, right?
Right. Yeah. So certainly, before leaving for Spain, we were aware that this was becoming more of an international challenge. It really hadn't hit the U.S. yet strongly at that point as we were making the decision to go, but the college left it up to us as a class, and we decided, we're willing to take what at that point seemed like a small risk to go over to Spain, spend a week in Granada in southern Spain, learning about a poet and an author that we've been studying. And so things were developing rapidly, just even in the time we were there. So we were following news, and then late in the night, like either Monday or Tuesday of that week of spring break, Harvard, Columbia were announcing their school closures. I think I think it must have been Tuesday night, President Trump makes this announcement that there's going to be an impending travel ban between Europe and America. And fortunately, we were able to change our flight up from Sunday to Friday, which was the last day of free travel.
Wow.
That was really, we had actually done that just right before President Trump made the announcement. Just recognizing things were starting to heat up. It might be nice to be back a couple of days before the end of spring break in case something happened with Swarthmore College. So we were fortunate to get that change. And then Thursday morning, we woke up at 5 and left the hotel to try and get to Madrid, before smaller cities were closing airports and train stations, because things were progressing rapidly in Spain at that point. And just within a day or two of us leaving, Spain announced a national borders closing, and so we felt very fortunate to be back. So it wasn't explicitly Swarthmore College's decision that forced us home, but more the international quickly increasing response and recognition of the severity of things.
And
thank you.
This is pretty typical of all colleges. I've gotten a lot of notices from my friends at the U, at BYU, at countries all across the country, universities or colleges all across the country that have been going through the same thing, moving to Zoom and having some really difficult challenges to overcome.
Yeah, absolutely. And one of the things again that we're hoping to focus on, and I didn't even know, Stuart, about your trip to Spain. So I'm glad to hear you got back home safely under the wire there. And there was a lot of confusion about whether U.S. citizens were included in that, had to get clarified that Thursday that U.S. citizens could return, but still,
Right.
and of course, it wasn't yet known at that point that Spain was to become one of the hot spots, right? I mean, I just checked the statistics before this started. There's 145,000 cases in the United States. Now, by far, the leader of coronavirus cases, Italy, second with 97,000, Spain, third with 85,000, and China, of course, where the virus became known to the world at 82,000. I'm going to turn now to Hannah Coyle, because you've had an interesting experience over the last 7 months. I wonder if you could tell us a little bit about where you went 7 months ago and what experience happened as a result of the coronavirus for you.
Yeah, of course. I've been living in Nanjing, China, the past like 5-6 months. And when the virus broke out, we were near Wuhan, so we had to stay inside for a couple months. So we tried to get home, but all of the airports were starting to close at this point. None of the big airline companies were coming to China anymore. So our flight got canceled 5 times. And then we finally got a flight to come home, and halfway to the airport, they canceled it. So we finally somehow figured out our flight home. And right once we got to the States, China set a lockdown in place. So we actually couldn't go back because they words. Okay. They decided that each household could only have one person exit the apartment complexes that have thousands of people living in them, and you have to get a card to leave. Well, we left before this was set in place, so we couldn't go back to our apartment. And my mother left with us, and she is teaching in China, so she had to work online and work on the online courses in the middle of the night. It was very stressful. And now China has set down a lockdown, so they're not letting any foreigners in to their borders. So my mother is stuck in China because she went back a couple weeks ago. My mother went back to China a couple weeks ago and was put in quarantine. And now we are separated because we can't get back.
So you kind of got hit on both ends, right? You were there when this happened, and then you tried to go back, or at least some in your family tried to go back. Tell us just a little bit about what your mother experienced going back there, and what it's been like for her to be back in China for the duration.
So China's actually over like the big hump of the virus, so they're actually back to normal. You can walk around, it's fine. But on her way back, the airline, so they check your temperature before you can get on a plane, and people sitting in front of her on the plane, they checked their temperature, they had a fever, but they let them on the plane anyways. So my mother, once they landed, they took that whole section of the plane and shuttled them to a hotel to be quarantined. So that's kind of how it's going over there.
And she was literally locked in. Is that right?
Yeah. So they gave them one room, and she couldn't leave. They, if she left the room, they could see her on all of the cameras. Like, she was fully in lockdown, couldn't exit the room. All she could do, she could exit the room to grab her food that they'd bring to her on trays, and then she'd have to go back into the room.
Yeah. Well, she's out of that now, right?
Yeah, she returned to Nanjing a couple days ago.
Okay. Well, that's good to hear. Thank you. And we'll come back to you to talk about what it's like for you now that you're back in Utah. But let's turn now to Ashlyn. You're in Tell us where you're at, Ashlyn, and how your life has been disrupted by the coronavirus.
Yeah, hi. So I am in Berlin. Yeah, I'm in Berlin. I am from Utah and I'm a BYU student, and I was taking a semester off and doing some research for my major here, just taking a real chill semester. And my family, as Hannah explained, had moved to China about the time I moved to Germany. And so we were all kind of split up. And so I moved here, and a couple months later, this coronavirus thing starts coming out, and it wasn't a big deal at first, but in early February, we had our first case in Berlin. It had been in southern Germany for a while. Germany and China have good relations, and so we have lots of Chinese tourists here, so it wasn't a surprise. But as soon as it hit Berlin, within like 2 weeks, no one had taken it seriously at first, but within 2 weeks, everything starts shutting down. I was also affected by that kind of shutdown, by that United States announcement that Stuart talked a little bit about, except I couldn't get back in time.
So you're stuck, right?
Yeah. So I'm actually stuck. And it was just kind of a weird situation because I had just moved. I had just started a new job as a live-in nanny 2 days prior to the shutdown. And so I wasn't in a place where I could just pick up and leave, as well as my family kind of being split between the US and China. It was just a really weird situation. So Berlin, a week ago yesterday, put guidelines in place where only 2 people at a time can meet. So groups of more than 2 people are banned countrywide. And everyone is supposed to be in quarantine in their homes. All public parks and squares and stuff are closed. So, for example, if I met a group of like 5 of my friends in a park, the police could come and ask for my proof of residency.
What's it like when you go out and walk around? I mean, you can go outside, correct? And just like a park is like blocked off. I mean,
Yeah. So I live directly next to a park, and there are gates in front of it that they just, I don't know why they just have gates and they're closed. But there's still people that like hop the fence. And so I go outside and there are people everywhere. Like I went on a run the other day, and it was almost harder to stay 6 feet away from people than it was during my daily commute that I used to take before the shutdown, because everybody is trying to take advantage of the sunshine and trying to stretch their legs because they don't have their morning commute anymore. And so they feel more of a need to get out of their houses. And so everyone conglomerates at what parks aren't closed and just on the streets and any park benches and stuff. Lots more people are being active and going on runs because it's the only justifiable reason to leave your home.
Right.
And nobody's wearing masks either. So if this has yet to peak in Germany, it's because people aren't seeming to follow the guidelines and measures put in place.
Well, what is interesting, Ashlyn, is that Germany, I didn't get to on my list. It's the 5th highest in terms of cases as of today, 63,000. But by far, they have the lowest deaths. And everyone's, this is kind of the latest news, is why Germany has an extremely low 560 deaths among 63,000. Everyone's kind of wondering, what is Germany doing so well? And we don't necessarily know. I don't think anyone knows that. But the message from Germany has been coming loud and clear from Chancellor Merkel. She's been talking about how dire and drastic this is, and gave a national televised address on March 18th, long before some leaders elsewhere in the world were taking such an active approach. So it's just interesting to hear that there is not, as of yet, a lot of face masks in Utah. I'm beginning to see some face masks, not as many as you see in photos from New York and elsewhere, but it's certainly beginning to raise in terms of awareness. So anything else just in terms of the environment that you're seeing there, and then we'll go to Elder Clark.
Yeah, so actually it's interesting that we're like the 5th highest diagnosed cases.
That's right.
Simply because the host family I'm staying with, we were personally exposed to the coronavirus through the preschool that my host brother goes to. There was a confirmed case in his preschool, and they had played together for a couple weeks, and so he was in direct contact with a confirmed case. And so my host family went into lockdown before Germany did, like all of Germany did. And we tried to go get tested, but they have these guidelines that you can't be tested if you're a child or if you're showing no symptoms. But the problem is that most children don't show symptoms. And so if they do pass along the virus, there's no way to prove that you had direct contact with a carrier.
Yeah.
Right. And there are so many people getting sick and just staying home because the hospitals are so dangerous right now. Because if I broke my leg and went to the hospital, I would probably contract coronavirus because everyone is in lines trying to get tested.
Right.
And so there are so many undiagnosed cases and different strains that are more severe and less severe. Some people just wait at home and sit it out.
Well, I mean,
I think that's why less, I don't know. I think lots of people here are, especially the elderly, are good at staying home. And so I think that might be a factor in why there are less deaths.
Right. Well, again, we're learning so much at this time about this, and the other thing to note is just yesterday on Sunday, the White House extended the Centers for Disease Control and Prevention guidance that there should be no gatherings of people 10 or more. That's the guidance from the White House. It's not an actual lockdown per se, the way certain countries have, and you've described, and Hannah's described her mother experiencing in China, but it's clearly affected daily life and is going to keep affecting daily life. That guidance was extended from today, when it was due to end, until April 30th, 31 days from now. So it's clearly impacting life. Now let's turn to Elder Clark to tell us a little bit about what you're doing as a missionary and how your life has been impacted by the coronavirus.
Yeah, thank you for having me. I'm currently serving as a missionary for the Church of Jesus Christ of Latter-day Saints here in Georgia, Atlanta North. So we cover most of the northern half of the Georgia state, and we're out here preaching the gospel, helping people come into Christ. And we also do a lot of community services. We help teach English classes. We do a lot of community service. We offer help with canned goods and resources that people might need for food storage. And a lot of those needs have really increased with this time of this coronavirus. And I've got to be honest, I'm very optimistic with how missionary work is going from a missionary stance with all the technology, all the tools that we have. Of course, it's very interesting to see the kind of the atmosphere, the attitudes around this. I'm currently in Gwinnett County, which is the second most populous in Georgia, and we're up there with the 3rd or 4th highest cases. I'm looking at the numbers right now. We've only had 1 death, but we have well over 150 confirmed cases here in Gwinnett County. And Georgia's just been increasing. They're similar to a lot of other places in the U.S. And it sounds like kind of similarly in Germany, there's a very limited number of tests. So I think we're seeing a lot of under testing here, where they could only do 50 tests a day in the whole state of Georgia for 3 weeks, and then this week they've only been able to increase that to 100 tests every single day. And so probably not a lot of people who likely do have contact. There's people we know who've tested negative for flu and strep and all these other possible symptoms and have had contact with confirmed cases, but they just can't get tested. And so that's kind of the situation we're seeing here in Georgia. But as terms of how this is affecting us, and really to draw this back, how the internet is really impacting us in a very positive way is how we are, as missionaries, are still able to go out and do work. As a collective whole, I can explain just missionaries as a whole are being sent out. We have missionaries all across the globe in almost every single country, and they're all having to be sent home. The leaders of our church recently made an announcement that everybody is going to return to their home nation. So we had people here from Canada, from Asia, Asian countries, Northwest, Southeast, everywhere, Indonesia. We had Tongan elders, and members from Peru serving here in missions, and Brazil. All the Brazilians had to leave recently. All these people had to get sent home. Just last night, our Canadians had to get immediately just yeeted out of here. They just had to get an airplane because borders are shutting down left and right. And we're having a drove of missionaries, thousands of missionaries who are being required by government agencies and being requested to be sent home to their home nations. When missionaries return home, they're asked to quarantine themselves for 14 days and not have contact with anybody, keep that social distancing. But then those missionaries who maybe haven't served more than 3/4 of their typical service, for elders, that's about 2 years, and for sisters, that's about 1.5 years. If they haven't completed that 3/4 and they're all healthy and fine, they'll often get sent out. So we here in Georgia, Atlanta, will likely be receiving more missionaries, even though we're in a lockdown situation. So what I was going to explain here a little bit, in Gwinnett County, which is the second most populous county in Georgia, we've been instructed to have a lockdown. So actually being here, we have too many missionaries.
Where are you right now, Elder Clark?
Yeah, we're in the towns of Lawrenceville and Lilburn.
No, physically, where are you right now?
Right now?
Yeah.
I'm in a family history center at one of our local churches in Lawrenceville. And so far as I know, only missionaries have come into this church building. Our church has paused all church services. There's no gatherings, rather than in-home sacrament meetings. And more specifically, in Gwinnett County, we've had to cancel everything. So we had baptismal services that we've had to cancel yesterday, and a lot of meetings that normally would have still been going on even with this tense coronavirus situation. And so with those things, we're still able to do a lot of work. We're still able to find people, reach out to people through Facebook, through WhatsApp is become a really very valuable tool in FaceTiming people. And we're not only teaching gospel messages and helping bring people comfort in this time. A lot of people have reached out to us saying, "Hey, look, I'm really concerned about my life and my family's life." They've either requested prayers or just wanted to talk to somebody about their life and where they're going after this life. But also, we've had a lot of success with teaching more people through our English class services, through teaching people about our bishop storehouses and emergency preparedness. From Georgia, church has their disaster relief headquarters for their LDS charities. And so to China was the first shipment of face masks. The church shipped all the face masks they had here from Georgia because of the Atlanta system. But really, in general, most things are shut down. Like Germany, like all these other places, nobody's on the road. Parks are overfilled.
I want to come back to this issue of your work you do and how it's changed. But we've actually got a question here from your mother, Elder Clark, and she's asking if Stuart and Elder Clark have been involved with healthcare. Does this virus make you think differently about your desires to work in healthcare? Let's turn to you first, Stuart.
Yeah, certainly. Actually, while serving as a missionary myself, I was involved in a pretty serious accident, and so got a firsthand taste of what healthcare looks like in that sense, and have wanted for a long time and still committed to becoming a doctor, going to medical school. I think this is, if anything, just increased my interest in being a doctor, having the skills to respond, the knowledge to know how to give good advice to help people in crisis. I think higher education, in whatever form it comes, gives us confidence and more knowledge about the world. And I think specifically with healthcare, there's a plethora of ways in which you can use that knowledge and ability to respond to help others in need, which has been something that's attracted me to health for a long time. And so I'm, of course, incredibly grateful for the many healthcare workers who are working around the clock and taking extra shifts and putting their own safety at risk in order to respond to this crisis. And really impressed by them. I have several friends who work in healthcare and a number of other acquaintances, and it's remarkable what they're doing.
Elder Clark, why don't you talk a little bit about some of the work you've done in healthcare and how this has changed your view of the healthcare world?
Yeah, absolutely. I concur fully with Stuart. This, if anything, this encourages me, right? Even though maybe the work that our wonderful people here in Atlanta are doing in CDC isn't necessarily I'm all the more engaged, right? I worked in quite a few years, clinics and hospitals before my mission. And it's been really great to hear from those people that were my friends there, those people who are still working there, and hear the increased demand, the increased need that they have. They've had a lot of from my former employees just about their safety measures that they're taking to really increase already very strict and basic like standard measures of cleanliness and cleaning to just a very much higher level of keeping their employees safe. And
Elder Clark, just describe, this was before your mission. You served as a medical assistant, and what kind of work did that involve? And you just were describing that's really the front lines, right? The people who are working in that area right now.
Absolutely. I would work beside usually nurses and doctors, just very basic stuff as a medical assistant. But I would be typically the one swabbing these people for this type of a thing, right? We did, a lot of Instacares, especially, get a lot of cases of strep throat, flu, and a lot also in family practice. And so those are really, really honestly, my friends in Instacare have been the ones who have been hit really hard by this coronavirus thing, because everybody's worried that they have coronavirus and they simply just don't have enough tests. They don't know how to really handle this very high demand.
I want to kind of broaden this discussion out a little bit to Hannah and to Ashlyn and Stuart, you as well, from an education perspective or from an interaction perspective. How has your life changed over the last 3 weeks? Hannah, for instance, to talk a little bit about what your school is like. What kind of school were you doing in China, and have you kind of gone back to a school in Utah? What's your situation been like, and how has broadband enabled your education interactions?
So I've actually been taking school online, even when I was in China. So my education hasn't changed much. The only difference is my teachers are actually, shockingly, they're not replying to emails, to questions. Their mind is elsewhere because their course is already set up. They're not required to be online. So I feel like my education has slowed a bit, which is shocking because I was already taking online school.
Mm-hmm. So is it online school, international school, or is it an American online school? What did you do when you were in China?
I take a online school through Utah. So I was doing Utah online school even in China. It was a little different there because you have to have a VPN to use any sort of Google anything. So in that aspect, it's a little easier to do my schoolwork, but yeah, it's interesting.
Right. Stuart, what about your situation? You did mention a little earlier about the classes that you were taking and the particular seminars, but could you just speak about how you interact with your classmates? What's changed in that area?
Sure. Yeah, I mean, yeah, really vastly different. A lot of people I don't get to see in person, and who I'm not necessarily close enough to call up frequently, especially as I have other things going on. And so missing out on some of those casual in-person connections, I think, that are integral for many of us in forming a healthy lifestyle. And so most of my social interaction comes from my family, who I'm home with all the time, and a few close friends that I'll call more frequently or interact with via text message or other normal technological connections. I mean, broadband, internet connectivity, of course, is essential to all of that, as we're kind of stuck in our homes and in different states and places, and trying to maintain some semblance of normal life. And that internet connectivity allows us to be in touch in other ways. So I'm grateful to have that in my toolbox repertoire for this response, certainly.
So you're in Ohio. Tell us a little bit about what things are like in Columbus there, particularly with your house of how many people, George?
Yeah, there's 8 of us here at home. Fortunately, we have enough space that we're not bumping into each other at every moment of the day, but sometimes it can feel a little crowded. I think this week my sisters are back in class. They've had a couple weeks off also during the transition to online courses, which in some ways is even more challenging for elementary through K through 12 education, where typically the students will be in each class every day, having lots of face-to-face interactions with their peers and with their teachers, and trying to figure out how to take the most important elements of that and move those online, or not necessarily put them online, but facilitate interactions that'll keep learning moving forward, and allow students a little bit more flexibility.
Are there individual tablets and computers that each student has in your school district, or have they had to work that out too?
Yeah, very fortunate that the school district is able to provide individual electronics to all its students. I think this year they actually switched from computers to tablets for all the students. I think they thought that would make for some more interesting ways to interact with technology and provide note-taking abilities for students in class. Though I think in some ways that provides an own set of challenges. There different functionalities between computers and tablets, but I think it will provide enough functionality for all of my sisters to continue learning from home. But of course, that's not the situation in many school districts, where students will have varying degrees of access to technology while they're confined from home. And so I'm sure many school districts around the country are thinking hard about how they're going to try to provide that to students, or adapt education so that it's still a possibility for students that may not have even consistent internet access, let alone the devices that would normally allow that sort of learning to go on.
Yeah. Well, let's turn to Ashlyn to tell us a little bit about what your interactions and experiences with others, whether teaching or interacting with people. What's it been like in terms of communicating with people in Germany, Europe, and then around the globe with your family in 3 different continents right now?
Yeah, so that's been difficult, especially because the day after I got put in quarantine, my phone broke. And so I really have been relying solely on the internet. But luckily, that provided lots of opportunities still for me to communicate with people. For example, I was able to communicate with my mother every day of her quarantine. And yeah, but the thing that has been different for me is I more than communication with people, was I could no longer go out to do my social research because I'm studying social anthropology, and I came here to attempt to do some research, and I could no longer be out interacting with people and observing. So I had to make a shift. And luckily, because of the internet, I'm able to still kind of study people's reactions to the coronavirus. I just shifted my subject of study. I'm just gonna, start from scratch. And the internet really provides a great source, a great way of still attempting to conduct some social research while I'm here, because I am in a unique place, and I have been able to see how people I know in Germany have reacted to the virus, because I'm staying with a host family here. I have some friends I'm still in contact with that I've been able to see how they've been reacting, but as well as things as simple as memes can carry a lot of meaning, actually, that really communicate the underlying fear that people have and how they're dealing with that. And so, yeah, I just think that the internet has really been pushing forward lots more than just personal communication. It can still keep companies and research and educational institutions going.
And you've done teaching and tutoring across the globe, haven't you, Ashlyn?
Yeah. So I moved in with a family with a 6-year-old a couple days before the shutdown, like I mentioned, and I'm starting to teach this 6-year-old how to read. They start learning to read a little bit later in Germany. And also I've been starting to offer online tutoring services because school's canceled everywhere, and I'm sure parents are going crazy, but also this is lots of students are at really important stages of their mental development and education at this point. And just because the coronavirus shuts down schools and kids don't get that one-on-one instruction that they need, doesn't mean that it should stop their progression and hinder their progress. And so things as simple as teaching students over Google Drive and video chat how to construct a persuasive essay, or teaching them what phonograms are so that they can put together words. I think even though it's over video, and even though nothing will be as good as person-to-person contact in a teaching setting, this one-on-one tutoring thing that is available through the internet it's the next best thing, I think. So that's what I'm attempting to do here.
Well, that's awesome. In a few moments, I'm going to do something unusual. I'm going to kind of open it up to round robin to let all of you talk with one another. But I want to go back to Elder Clark for a moment and ask you, talk just a little bit more about the day-to-day things you would do as a missionary. And given that I gather you can't do those day-to-day things, what do you do instead? And talk about how you use social media as a missionary, and talk about the Bishop's Storehouse that you visited. And you've got a great Facebook post on that we'll put a link to on the site here. But tell us a little bit more about what missionary life is like pre-corona and post-corona, Elder Clark.
Yeah, I'd love to. So as a missionary, we're going out. You've probably seen us knocking on doors, and we love to knock doors and ask if we can come in and share a spiritual message. A lot of our other activities are spent going just teaching people about teaching people about Jesus Christ, or teaching English classes, right? Helping do yard service. All of these things usually require human interaction, right? Even simple things like eating out or eating with members, we can't do anymore as missionaries, right? And that's really hard. At first it was really discouraging, but what I've seen is this kind of, I've loved seeing the creativity that some of these missionaries have in all that we can do. We're so blessed to have have this technology of Facebook or WhatsApp where we can reach out to people that we've already been teaching through face-to-face. And just like Ashlyn said, you know, human interaction is just so key. It's much more personable. It's so much easier to convey a message or teach clearly. But the next best thing really is just a video chat. And oftentimes it solves a lot of other problems of time, travel, distance, all these things that you normally have to keep in check. And so we've actually seen as a missionary group as a whole, a lot, you either kind of see this divide where there's a lot fewer lessons being taught, a lot fewer people being contacted and reached, or you're seeing just a massive explosion of people who are just able to teach lots and lots of people through these many means of technology we have. One thing that's been really successful is we've been teaching English classes via Facebook Live. And so every Tuesday, Thursday, Saturday, we have a local class that normally we would have. We had a pretty decent following of people that were coming in every Thursday. That usually averaged around 20, 25, 30 people. And now we're seeing hundreds of people tune into these video chats, and lots of these people are asking us, requesting for these private lessons. And so it's turned out to be kind of an opportunity for us to kind of push our limits. See, okay, just how far can we take this with these crazy ideas? Or, oh, you know what? Like, why didn't we think of this beforehand, right? Why weren't we doing this before? And so, yes, it can be a little discouraging. It's a little frustrating that we can't go out and talk to people. We can't knock doors, but it's been great to be able to see the creativity that some people have and how we're able to kind of expand our outreach and our operations.
Well, wonderful. Who has questions for the others of you here? Go ahead, Elder Clark.
Yeah, I've got a big question for you, Hannah. What was the process in you returning? You don't, not like play by play, but just what was the process for you returning to the United States? And Stuart, you too. What is the process that's involved in coming back to the U.S.? Because I know for a lot of missionaries, some of them are trapped. They're trying to get back from Peru or from Guatemala, but the airports just aren't taking off, right? Or we were having a hard time getting some of the missionaries that were supposed to go back to Brazil. What's the process going on here with countries?
So the process, it really just depends on where you are. But for us, it was stressful because since we were near the hub of the virus, where it was at the time, it was hard to get flights because no American flight companies wanted to come to China to pick us up. And it was hard to even get to the airport because everything was shut down. I was in lockdown in China for a while and no one was outside. The only people outside were security guards and police officers, and they were checking your temperature, your passport anytime they saw you. So yeah, you really can't leave your apartment because they check your temperature and your ID, and if you have a temperature, you go straight to the hospital. So getting to the airport itself was a whole ordeal on its own. But we finally got to the airport and our flight got canceled because Delta doesn't want to come to China. So we had to reset our flights at the airport an hour before we left to go to Korea, and from Korea back to the States.
Wow. So it sounds like it's more with the airplanes. What was the situation with you with Stuart or with Ashlyn keeping you in Germany?
Yeah, I'll jump in real quickly. Mine was very simple, actually, the way it worked out, which was remarkable, and that the airport was still fully operational when we left, and so got on the flight without any issues. And they did ask us like a few extra questions, security before we left, just because we were leaving the country, and things were starting to heat up a little bit with the virus there. But even on our return, so the flight went smoothly. Even on the return to the U.S., though, went through customs like normal. There weren't any extra health checks or extra security screenings per se in place yet. We had been hearing some reports that there were certain airports that people were being routed to, and we were worried we weren't going to be able to land in Philadelphia, or that they might, not let us leave the airport there, reroute us to somewhere like New York that maybe would have more capacity set up to screen incoming flyers, but nothing like that had been set up at the time. I don't know if that has changed. I haven't been following airport news or anything. So fortunately for us, it was a really straightforward process. But I imagine that as countries are shutting their borders, that now it's very, very difficult to leave. Similar, or if not impossible, to handle the situation in China.
Yeah, it's a little interesting to see how the airports were going from different countries, because for me, I got checked every stop that I had at the airport. They checked my temperature and they did a health check, a health screening. My customs took 4 hours because they made us go through customs, go through a health check, and then go through customs again. So wow. It's interesting to see the difference when China was, had more cases than Spain at the time. So
yeah.
Ashlyn, what's it like to I mean, I don't know if you've even been to the airport there recently, have you? I mean, but just in terms of like public transit, is it shut down yet in Berlin? What's it like?
Yeah. So I was flying about a month ago. I was on a weekend trip, but everything was fully functional and operational. Nothing really changed until 2 weeks ago, almost to the day, when Berlin started implementing guidelines and things like that. And so now, to travel and to go on public transit, you need a reason. So, for example, my host mother, she works for Deutsche Welle, which is the news forecasting company here in Germany and in Berlin. And so she's registered as an essential worker, and she has to have documentation stating that she is an essential worker, so that if she gets stopped on public transportation, they'll let her go, because nobody is supposed to be traveling across the city without good reason, which is why if I was just, walking around or loitering or like going on random public transit, the authorities could stop me and ask for my proof of address, because if I am not in a near vicinity of where I'm living, or it doesn't seem that I'm just going to the grocery store and back, then that could be a problem.
Right.
So there is some some measures being put in place. Yeah, here. So public transit is like strongly like discouraged.
Gone. It sounds like just generally like, China, Europe, America, even though they're all now kind of, well, actually America and Europe have exceeded China in terms of cases. China has a much more controlling attitude. Europe kind of somewhere in the middle. And again, we don't have anyone from New York or Seattle, and we've certainly talked to people who just describe nothing happening. It's pretty much died down in Utah, where I am. I assume in Ohio. But what's it like in Atlanta for you, Elder Clark? And when you go outside, are there people out on the streets? I mean, or are you just pretty much staying in the apartment the whole day?
Chick-fil-A has gotten more busier than ever, and a lot of drive-thrus are increasing their business, but most other things are being closed down. So besides absolutely required healthcare systems, there's actually been 3 or 4 counties that have actually established kind of a similar hall pass type of system. You have to, the police can stop you on your drive, and you need to have proof that you're permitted to be allowed in that county. And you have to be able to prove that you are essential worker. So either some form of healthcare or mental health care worker, certain grocery stores, not even all of them, and for some reason a few restaurants as well, that particularly offer carry out or drive-through services. are still permitted to go out and to work, but a lot of other jobs have just been shutting down like crazy, left and right. So in the greater Atlanta area, it's gotten pretty. It varies from city to city, but it's gotten pretty restrictive. Public transportation still is working. We just saw a Gwinnett County bus driving today, but it had, I think, 1 or 2 people on it. So it's dying down a lot very quickly.
Elder Clark, I want to give you a chance to talk a little bit more about the Bishop Storehouse video that you posted, and what is the role of the Bishop Storehouse generally? What is it, first of all, for those who may not be familiar with that term, and what's its role, and particularly now, what kind of precautions are people taking there?
Yeah. So the Bishop Storehouse, it's actually also one of those things that has been marked as essential or potentially essential item. The Bishop Storehouse it's organized by the organizing bishopric of the church, who offer through donations and tithes of members, offer disaster relief and necessary meals and resources to those who are maybe less fortunate and don't have as much. And so from the Bishop Storehouse comes a lot of produce, meat, canned foods, goods, all these things that are often given to lower income families, and specifically to disaster relief. They have a very large setup for situations. From the Atlanta major warehouse that we were able to work in, and I gave a tour of, there is that's where they often help out to hurricanes. So this past a year ago in Florida and in what was the other hurricane recently in Puerto Rico, I think. All those hurricanes, they often just ship out all this material for free, because the church has such a large donation system. They're able to give away all these disaster relief, and they've seen a huge uptick in need and demand during this coronavirus situation. They've ramped up their services in providing canned goods, foods, fresh produce to those who can't afford it, and maybe those who need it. In terms of the precautions that they're taking, it used to be that people could come in and place orders, and now nobody can enter without approved permission. They have to enter. There's extra precautions taken at every corner, every check-in, to make sure to wash hands and wear personal protective equipment. And so there's definitely an increase in measures. I know similar things are happening at Walmart or at Home Depot. They're only allowing 10 people in at Home Depot at a time a couple days ago, but these are rolling out pretty quickly, right? It's changing almost day by day.
We had a question about how each of you are feeling about the prospects for future education. Hannah, what are your plans? How are your plans to apply for college changed? Ashlyn and Stuart, how does COVID-19 change your college programs or graduation dates?
So I am a little unsure of how to apply for colleges, because at this point, you don't really know when exactly it's going to end. Especially in China, the lockdown was for 3 months. No one could leave, and they just got over it. So the lockdown not being as tight here, I'm unsure of when it will be lifted. So I'm definitely a little unsure of what to do for my applications to college. And it has become harder because all testing centers have been locked down, so I actually can't take the ACT. So applying for college at all is actually hard at this point, because I don't have any of the tests or the scoring things that I need to apply for schools. So that's currently the issue that I'm having, is all the testing centers have closed.
Yeah, Stuart, let's get to your reaction to that and any final thoughts you have for our audience.
Yeah, certainly. I think in my case, the next application is medical school. And so thinking through how and when to really engage that process. I know that these organizations are thinking and they're aware of how this is impacting the students out there that are wanting to apply for the next step in their education, and are looking for ways to be adaptive or a little more flexible, a little more lenient with some of the requirements in light of that. And fortunately, my graduation won't be affected. I'll still be able to graduate. I won't be able to walk or anything, of course, but I'll get a diploma as long as I finish out all the coursework this semester. But I think it's an exercise in patience and flexibility for all of us to be patient with one another, with other organizations as they're taking some extra time to sort through how to screen applicants and provide work opportunities. Obviously, hundreds of thousands, millions of people are out of jobs right now, and that's a difficult thing, whether that's within education or in many other sectors that are negatively impacted by not being able to meet up physically. And so I think it's something to be aware of and try and be patient with, but hopefully not stress too much. Try and be hopeful.
Well, and patience is definitely a watchword, right? I mean, I've tried to say on every one of these webcasts, you got to lower your standards a little bit, because sometimes there's buffering, sometimes broadband systems have problems. Ashlyn, let's hear some of your thoughts about what this means, and also kind of the economic and political impact of this going forward.
Can you be a little bit more specific about what you mean by what does this mean? Sorry.
Well, so yeah, what are your fears about the impact of coronavirus? Are you more afraid of being able to come back to the U.S. at some point, or are you more afraid of what happens? What's our world like after this ends?
Yeah, well, I think aside from the obvious social whiplash we're going to have of people being more afraid of each other, for lack of better words, I think just basic social interactions will change. But also economic backlash. We already see the beginnings of a recession. We see people losing their jobs back to, like at rates like in 2008, where new job offers are being rescinded and low-level workers are losing their jobs. And it's very difficult to find work. My host mother, she's an essential worker for a news station, an important job, and her hours are cut back, and people are being paid half-time at best for the work that they are unable to do because of the coronavirus. And so there's obviously going to be some economic backlash. And then who knows what will change on the political scheme of things with relations between countries, how we feel, who starts to play the blame game perhaps of who didn't close their borders fast enough, as Germany was one of the last countries in the EU to actually close their borders. And so it's just kind of interesting to see what's going to happen and see the start of what has already been happening, and to see how that will progress further, because as we all know, things progress exponentially.
That's right.
Typically.
No, thank you for those thoughts. We do like to wrap up, but let's go ahead and give Elder Clark a final opportunity to comment on what you're seeing the future and how your future will be different because of this.
Absolutely. I agree with everybody. There's prospects of college is going to be very interesting, right? The university I was enrolled in has recently announced that they're not going to do any on-campus classes this coming spring-summer term. They're all via online, right? Or through Zoom call, which a lot of other universities and my college-age friends are doing. And I know even high schoolers are using some of these really great tools, right? Through Zoom. There is definitely going to be a big impact on our economy and on just everything around us, right? I have a missionary companion who's very interested in the financial sector, and he's been telling me about these crazy drops in the financial scheme of things and in that sector of the world, right? And there's a lot of other kind of negative impacts that we can kind of foresee. We can kind of like already look to the past to see, okay, well, what's going to happen here in the future? And I don't know if we've quite realized the scheme or the size, the scale of this. But for me, I look forward to the future with a lot of optimism, a lot of hope, seeing this. A lot of missionaries, we don't know how long we're going to be in quarantine, in modified self-isolation, or in lockdown. This could go on for, some people just thought it would be a couple of weeks, but I think this might be for months. I think this is going to be a permanent, almost a half a year long change to how we do things. But I think with the tools that we have, with the resources, and with the right attitude, we're going to see an increase in our potential and ability. And I think that this is universal to everything, right? Yeah. I think that this goes along with education. This goes along with work. People always ask for more in-home work, right? Stay-at-home work. And yeah, this is kind of pushing those boundaries.
Great. Well, listen, thank you so much to each of you, Stuart and Hannah, Ashlyn and Elder Clark. We appreciate you taking the time to be with us. And thank you to our audience for staying with us, a slightly longer version. Tomorrow we'll be back again for a Broadband Breakfast Live Online, and we'll be talking about the critical need and importance of universal access. I'm Drew Clark. Thank you for being with us.